All right, so welcome back. This is the second episode of my podcast, and I've brought on a special guest today, a very good friend of mine, Dr. Eric Balcavage. Eric, where is it again that you practice?
I'm in Glen Mills, Pennsylvania, southeastern corner of Pennsylvania.
Awesome. So we've reached outside of Idaho today to grab Dr. Balcavage from Pennsylvania, and Dr. Balcavage can be found at the Chronic Condition Recovery Center.com. He also has the Thyroid Answers podcast with Dr. Riggleman on iTunes and thyroidproblemsdoctor.com as well. And what we wanted to really get in and talk about today is gut health. And I think Dr. Eric would agree with me when we start talking about gut health that the single thing we see in common with all of these patients that we see is that they have bad gut health. Would you agree with that statement?
Yeah, I think it's a foundational problem for almost everybody.
A foundational problem for most people that we see that come through our office. And now, keep in mind, by training, we are both chiropractors.
Right.
But our practices are very, very unique in that we specialize in these chronic disorders like thyroid, diabetes, neuropathy. We see a lot of brain-based stuff. And when it comes down to it, the most things that we see are actually gut problems that we're working on to heal. So now, thinking about people who are listening to this, Eric, how would you define the gut? What would you say the definition of the gut is?
Well, the gut is essentially from nose to anus is essentially your mucous membranes, and that really constitutes the whole aspect of the GI tract, right? So most people when they think about gut, they think about their stomach. But from the time that you think about food, to the time you put food in, to the time it exits the other end, we're talking about the GI tract. And the mucous membranes are pretty similar all over. All the areas that have mucous membranes, lungs, sinuses, GI tract, really are all the immune system there is pretty much the same thing. Circulatory IgA system, that primary immune system, is pretty much the same. So you dysregulate one, you dysregulate all of them.
How important is that mucous membrane in maintaining health?
It's a key piece. I mean, it's definitely a key piece. There is some controversy regarding the testing of secretory IgA. Some people think it's kind of a variable number, but I think it's pretty consistent. When you see that somebody's got compromised physiology, they've got autoimmune issues, they typically have a weak secretory IgA system, and that's like if you think about the GI tract, there's layers of defense, and that secretory IgA system is kind of like that last line of defense before we start damaging the cells.
Right. So what I tell patients all the time is this: your body needs fuel to survive. So when you put food into your mouth, you basically convert it into energy, and that's what gives us health and vitality. Now, let's just do this. Let's just simply go through the gut step by step and talk about the different areas. So you're talking about secretory IgA. When you put food in your mouth, this is where digestion really begins. Okay? So your teeth begin the mechanical breakdown, but you also have enzymes that are released from your saliva that begin to break it down there as well. So the digestion really starts there. So once we swallow, the first place that we hit is the stomach.
Right.
Okay. Now, let's talk about stomach acid for a minute. How many patients do you see every day that are on omeprazole?
About half of the patient base on some level of medication to suppress stomach acid, or I should say to address their reflux.
Address their reflux. I think I'm glad that you said that, because I know your practice is very similar to mine in that we see these people that are coming in with reflux issues, but they're really not having a stomach acid issue. They're having too little stomach acid. Right. When you have too little stomach acid, you don't break down your food properly, and the stuff that's actually coming up causing the reflux is actually lactic acid, not hydrochloric acid. So let's just touch briefly on when your stomach acid is actually too low, what that does divided by B12.
Well, you need an acidic environment for B12 absorption. So anybody who's got low stomach acid or taking anything to suppress stomach acid is going to have reduced ability to absorb both B12 and iron. So they're going to be B12 and iron deficient, which is going to affect every aspect of their physiology.
Right. So when you're B12 and you're iron deficient, you develop anemia.
Absolutely.
And you're not getting fuel to the system. And so you see these patients that will literally show up in our office. Most commonly, they're just complaining of fatigue, but they think they've got a thyroid problem.
Yeah, and they could, right?
And they could, and it could be driving the thyroid problem. But just from that first step, we look at stomach acid to see where the issue is. Now, what do you typically do for someone who has stomach acid issues?
Well, obviously, if they have stomach acid issues, we look at a couple things. One, we definitely want to find out if they have a thyroid problem, because thyroid physiology is key to producing stomach acid. Second thing we want to do is we want to look at their history and find out if they're taking any type of antihistamines, because antihistamines will also suppress stomach acid production. Then we want to take a look and see if they're taking any type of antacid support, and if they aren't taking some type of antacid support, then we're going to look at what we can do to start to address stomach acid production. We also may want to consider doing some GI testing. Depending on their situation, we may consider looking at H. pylori as a potential issue. We also may want to take a look or consider that there may be some, if they have any other autoimmune issues going on, we may want to take a look at if there are potentially some autoimmune issues, damage to their parietal cells which could impact their stomach acid production. So those are kind of the key things to take a look at initially.
Awesome. All right, so we also know that when stomach acid is too low, we're not going to get an appropriate response from the gallbladder, so we won't get appropriate bile secretion. But not only that, it's going to affect insulin secretion as well, because insulin won't be released appropriately if you don't have the same amount of stomach acid. So it very much could be affecting your diabetic patients as well.
Yeah. So when the amount of the amount of acid or the acidity of the GI of the stomach contents entering the duodenum triggers enzymes in the duodenum that stimulate secretion of bile acids, right? So that's important. And it also stimulates the secretion of the pancreatic enzymes that are needed for digestion and the release of bicarbonate from the pancreas. So if there's decreased stomach acid, then there's going to be decreased bile acid secretion. And so one of the things that happens with that is then we lose our antimicrobial effect of our bile acids. Those are the things that kind of keep our small intestine clean. We also lose the ability for, if we have less bile secretion, to absorb fats and fat-soluble vitamins. So we're going to be vitamin D, vitamin E, vitamin K deficient, A, D, E, K. The last thing is we're going to have a hard time detoxing the body because we need to release bile to get toxins out of the body. The other piece of that is if we don't have appropriate acid, then we don't get appropriate release of pancreatic enzymes to break down our proteins, our fats, and our starchy type carbohydrates, and we don't get enough bicarbonate secreted. And so what happens is the pancreatic enzymes work best in a neutral pH. So if you have acids entering the duodenum and you don't get appropriate levels of bicarbonate secretion, the acid, even though it's not as acidic as it should be, the acid coming from the stomach will neutralize or damage the enzymes from the pancreas, and will still lose digestive function.
Right. So bottom line is, we're not going to get the nutrients we need.
Yeah, absolutely. You're going to be deficient in many nutrients because you stop the rest of you slow the rest of the digestive process. Right. The absorption of nutrients aren't going to be as good, and you wind up with bacterial overgrowth, and now you've got the bacteria stealing the nutrients, or bacteria fermenting the foods, producing gas, bloating, pressure, inflammation, and a whole host of problems.
Okay. So let's put that then in a functional neurology frame. Those fat-soluble vitamins, A, K, E, and D, and if you want to remember those, I always think, who wants to see a fat guy naked? A, K, E, and D. fat soluble vitamins.
Okay.
Hey, but those vitamins are very much needed for proper brain nerve growth.
Yeah.
So it's not uncommon for you and I to see people who are getting into the early stages of dementia and brain dysfunction because they're not absorbing fat-soluble vitamins. And even we can get into the neuropathy discussion as well. If you're not absorbing those vitamins, you're just flat out not going to make new nerves, period.
Right.
Okay.
Yep.
So, all right. So I think that pretty much covers the stomach acid, covers the insulin pancreas, gallbladder. So the next stop, we drop into the duodenum, which most people are going to know it as the small intestine. Okay. What's the most common problem you see with the small intestine?
Probably one of the biggest challenges we see in the small intestine is what they call SIBO, small intestinal bacterial overgrowth. And when people have any level of slowed motility of the GI tract, if they have any gas bloating pressure, if they have any damage to their ileocecal valve, they can get overgrowth of bacteria in the small bowel. And there should be small amounts of bacteria in the small bowel, and it's really important that there's small amounts there.
Right.
But what we see is a lot of overgrowth in that small bowel.
So,
and when you get overgrowth of it, it creates problems.
A majority of our bacteria that we have to survive as human beings, a majority of that should be in the large intestine. Mm-hmm. But what you're saying is people with that junction between the small intestine and the large intestine, it gets damaged or worn out or whatever, and that bacteria spills over into the small intestine.
Yeah, it moves upstream versus staying downstream.
Right.
So if there's two major things that create overgrowth in the small intestine, one of those is slowed motility. Mm-hmm. If the food sits longer and doesn't move through the GI tract, then bacteria has more time to act on it, ferment it, and create this overgrowth. The other is that we lose the innate antimicrobial capacity, which we talked about already, and that is the lack of bile acid secretion or healthy bile acid secretion and the lack of pancreatic enzymes. If we lose either one of those two things, we're going to have bacterial overgrowth.
Right. And the way I put it with patients is that bacterial overgrowth, when that happens, it's like those bacteria, I can't remember exactly how the saying goes, that those bacteria eat nutrients and poop toxins versus eating toxins and pooping nutrients. Okay?
Absolutely.
But when that happens, that bacteria literally is robbing you of the energy that you need for your own survival. It's taking it from you and using it against you, and that may be one of the reasons why you're fatigued.
Absolutely. I mean, B12 is a great example of that. If you have a person who's got bacterial overgrowth, bacteria in organisms will consume B12. Really, I mean, that's a favorite fuel source. So they'll consume those things, give you B12 deficiency, which will then in fact impact not only energy levels, but the ability to do something called methylation or to methylate. And you need methylation reactions to make healthy cell membranes, to make healthy intestinal lining, to make healthy tissues. So without methylation, you can't make energy, you can't make ATP. Without methylation and that B12, then you can't absorb, you can't make healthy cell membranes and cell walls. So you're always going to have some damage to the intestinal lining. And the body, when it's healthy, it repairs it pretty quickly.
Right.
But if there's fat-soluble absorption problems, or there's methylation problems, or B12 problems, it becomes really hard for it to heal and repair.
Okay. How do you see food sensitivities playing a role in all of this?
So it's an interesting point, because what we typically see is that we typically see a lot of people with gluten sensitivity, right? And gluten is this protein and gliadin are proteins that are found in wheat and wheat-based products. Almost every grain-based product, corn, wheat, barley, rye, rice, all have these gliadin-like proteins, these proteins that can irritate the GI tract. They don't have to, but they can. Some people have genetic predisposition to them. Some people, I think it's just a massive consumption of these things with an already weakened immune system. But these things can be almost like sandpaper, just roughen up and irritate the surface and cause damage and inflammation. Once you get some of those foods starting to irritate the tissue, now the nervous system starts sampling what's out in the gut, starts seeing these proteins, maybe they're improperly digested proteins, and it says, listen, there's a lot of these things in the GI tract, they're creating some irritation, we're going to create some immune response to them, and now you develop food sensitivities.
Right.
And it may start out with things like gluten and dairy. They're probably two of the most common things. But the reality is, once you have what we call a leaky gut, damage to the intestinal lining, any food that a person eats with any frequency can become a food they become sensitive to.
Right. And what people don't understand is that reaction does not stay in the gut. That reaction spills over into the bloodstream. Most commonly, it's going to cause neurological damage. Okay, the issue being your brain does not have pain receptors in it, so you're not going to feel that it's causing inflammation like it would have your inflammation in your knee. So from what I see is we see nerve damage, we see brain issues, but we also see things like skin issues, we see joint issues, we see all these other issues because that's all spilling over from the gut.
Yeah, gut inflammation becomes systemic inflammation.
Absolutely.
And the immune system of the gut and the brain are tied, so the brain becomes inflamed. And I think the statistics, and you can correct me if I'm wrong, but about 90% of the cells in the brain are not for thinking, they're immune cells.
Right.
So inflame the brain, you really create a lot of change in the brain. Right. And that can be like trying to run through a swimming pool is how I try and explain to my patients. The nervous system just does not work as well.
Right.
It's interesting too, when we talk about the leaky gut, it's not just inflammation that can create problems. If you have damage to the intestinal lining, it does affect absorption of nutrients. The micronutrients, the little things, don't get absorbed, but the big things do wind up getting through these leaky areas. I kind of relate it to like a screen in your window. If you had a screen, you've got tiny little holes in the screen that allow air to come through but keep the bugs out. That's kind of like the intestinal lining. There's little teeny tiny holes to allow the properly broken down digested nutrients to be absorbed. But if I punch some holes in the screen in your kitchen window, now you're going to have everything coming into the kitchen. Bugs, bees, butterflies, everything. While some of those things are really nice to see and they're pretty outside, they're not so fun to have inside the house. Inside your house, you start spotting things and killing things and maybe hitting somebody with a fly swatter because you're trying to kill the bugs. And it's the same kind of chaos that occurs in the GI tract. And so sometimes people think that, maybe I just need to get rid of gluten. Well, at this point, once you have damage to the GI line, gluten may not be enough. That's like saying, okay, Brady, you stand outside and kill all the flies. Just keep the flies from coming in. What about the bees, the wasps, the butterflies, everything else? They can still come in. We have to fix the damage.
Right. And not only that, but the grains that people switch to when they go on a gluten-free diet, those grains can get through that screen and cause the same inflammatory reactions.
Right. If those proteins aren't broken down appropriately to amino acids, they can create a problem. And they have gliadin or gluten similar presenting proteins, so the immune system can mistake those proteins for a gluten reaction. And the other piece of that that's important is that if there's a leaky gut, the bacteria that may be normal in the GI tract can leak or translocate through that GI lining and get into the lymph tissue and into the systemic tissues, into the bloodstream. And then what I see, and I've talked about this numerous times, and it's now starting to hit the research more and more, is that what happens with people who think they have chronic joint, I got a bad knee, I got a bad hip, I'm just getting older, I played sports, whatever, what we're seeing is what's called bacterial or candidal arthritis. And what happens is somebody's got a knee injury, somebody's got a hip injury, they've got a little bit of irritation or inflammation there. And maybe it's never been a big deal, but the bacteria and the yeast get into the bloodstream, get into the joint cartilage, and when they find an injured joint and some inflammation, this is like a perfect breeding ground for them. They actually produce something called hyaluronidases, and the hyaluronidases are enzymes that will break down their joint cartilage. So what we see is people, and you know who these people are because they come in and they've got one knee done or both knees done and a hip done, and now they're getting the other hip done,
right.
and they got a bad shoulder. So every joint is irritated, and they're assuming it's just old age and hard work, and they wear it like this badge of honor, right? Yeah, I did hard work. And the reality is it's just chronic inflammation that's caused from the gut. This leaky gut syndrome, and bacteria and yeast get into the tissue and just destroy the joint, and nobody's looking at it.
Because it's a badge of honor. I got titanium hips.
People, if you think about it, especially if you're a guy, you're just thinking that's the way it is. And if they went to the best orthopedic surgeon, and that surgeon is just looking at a joint, hey, it's a degenerated joint, it's arthritis, and the assumption has been that it's always been old age, right? It's a condition of old age.
What you're telling me then is that bone-on-bone arthritis can be caused from improper gut function.
Absolutely.
Boom.
How many papers do you need?
I know they're there. I'm just prodding you. So
right.
We've gotten through the small intestine. We'll get into the colon a little bit. We know the fat-soluble vitamins are absorbed here. What else would you say about the colon before we wrap this up?
The colon, is one of those key things. That's where most of the bacteria is going to be. But it's key. There's a balance that has to occur there between good bacteria, some of the problematic bacteria. That's where a lot of resorption of nutrients are. Some of your fat. We think of things like the butyrates and things like that are absorbed that are key. A lot of toxins can be reabsorbed there. So the health of the colon is really, really important. The nice thing about the colon, which is a little bit different than the small intestine, is it's a lot easier to measure what's going on in the colon with stool ecology tests. The small intestine is much harder to measure what's going on there. But we can get a much better feel of what's going on. One of the biggest things that people have to be cautious of or concerned about is just because they don't have pathology, if they go to their doc and they get a colonoscopy and they get it checked, just because they don't have overt disease in there doesn't mean that they have healthy colon function or healthy small intestine function.
Right.
That just means they don't have a pathology disease. And in the world of gastroenterology, if you have symptoms but no overt pathology, they call it a functional GI disorder, and they'll slap it with a label like irritable bowel syndrome, which is really just a trash can diagnosis. But the health of the colon, critically important. And most of the absorption of nutrients is really in the small intestine, there's still a ton of things that have to occur and happen in that colon, and its health is really, really important.
Awesome. Well, listen, we've covered a lot of ground today. Okay, we've covered basically the definition of the gut is starting here and ending in the anus. We've talked about stomach acid. We've talked about overgrowth in the bacteria. We've talked about food sensitivities. We've talked about the colon. Anything else that you want to touch on, Eric?
I think probably the only thing people need to be aware of is understand that bowel motility is key, and that there's a lot of people who think they have normal bowel motility, and when you ask them how often they have a bowel movement, they'll tell you, I go regularly once a week, or I go regularly every 3 days. So for your listeners, it's really important to understand that in a healthy situation, you have 1 to 2 nice, solid-looking stools every day, right? They should be kind of a darker color. They should be well-formed. They should come out really easily. They should not float. And if that's not your situation, then you've got GI problems, whether you're gassy, bloated, pressure or not. You need to be moving your bowels every day, at least once or twice a day.
Awesome. All right. I appreciate you doing this with me.
You got it.
This has been great. Again, this is Dr. Eric Balcavage. You can find him at the chronicconditionrecoverycenter.com. You can find him on the Thyroid Answers podcast on iTunes, or you can find him at thethyroidproblemsdoctor.com. You've found my podcast. You know where to find me. Eric, I appreciate you being here. we will touch base with you very soon, okay?
You got it.
All right.
Thanks, Brady.
Thanks, my friend.
Take care.
All right, take care. We'll see you on the next episode.